Hi, I'm Dr. Serino from EuroHealth Forum. This is a video coverage of the article MRSA Infections, Three Ways to Avoid Colonization and Infection. This article is packed with information on preventing colonization and reducing your risk of getting recurrent infections with Staph aureus. MRSA is basically a designation, a term used um, specifically to antibiotic resistance, in this case, methicillin-resistant Staph aureus, as opposed to methicillin-sensitive Staph aureus. Now, what is methicillin? Methicillin is an antibiotic that was produced after penicillin. It is another iteration of penicillin. It was produced in 1959. And in the 60s and 70s, we saw a great deal of resistance to this antibiotic arise, predominantly in the hospital. And in the 80s to 90s, it became more of a community-acquired pathogen. Now, Staph aureus is actually sometimes referred to as a commensalist. It really doesn't usually cause problems, and a quarter of the population is colonized with Staph aureus, meaning that is the bacteria that they have in their on their skin. Usually, it's in the nasal oral pharynx, but it can be in the axilla. It can be in the groin as well. what are the risk factors for Staphoroids? Well, there are risk factors. So there are reasons why we develop infections of our skin. Some of those risk factors are simple because of just blunt trauma or injury can lead to infection. Staph can be found on objects such as razors, keys, etc. And it can also be spread through skin-to-skin contact. We can take antibiotics that can affect our skin. If you can imagine a broad spectrum antibiotic that doesn't treat MRSA can increase the risk of that showing up as either acquiring it to be a new colonizer or showing up as our predominant bacteria of our skin. Now, there were some traditional epidemiologic associations. We saw higher rates of infection in the homeless population, prisons, military groups, hospitalization, astroturf injuries, and reservations. We also see this with behaviors. Men who have sex with men have a higher rate of MRSA colonization, as well as illicit drug use, injection, or inhalational use. Conditions increase the risk of MRSA, including HIV, hepatitis C, and diabetes mellitus, but also cirrhosis. We can see this with certain medication use, including antibiotic exposure, steroid use, immunosuppressants, as well as non-steroidal anti-inflammatory medications or NSAIDs. And if you have a device in, whether it's a med port or a hemodialysis catheter, this will also increase your rate of colonization for staph. So how do I prevent myself from getting staph? Well, number one, good hand washing, but not too excessive, because excessive hand washing or showering will dry out your skin and subject it to increased risk of injury. It's also washing off these oils that we have, as well as antimicrobial peptides that are produced by our body to reduce the rate of skin infections. Sharp razors, you want to use those when you're shaving, as opposed to blunt or overused razors, which can cause more trauma to the hair follicles and skin. Obviously, any cutting injury can increase your risk for staph, but certainly those blunt traumas can lead to an increased risk. You can apply alcohol to a razor before and after use, and do not share razors. Use a moisturizer for skin after shaving. If you have any skin conditions such as eczema or psoriasis, get those treated. That will reduce your rate of colonization. Some people, we ask if they have any pimples in the past in their nose, because that can be a precursor to getting skin infections. If you do have a pimple, don't try to express it. You can put a Band-Aid over it with a little bit of antibiotic ointment. Sometimes if the process is deeper, it can be greater inflammation will mean that it may need to be incised and drained. Use non-steroidals and steroids. Try to avoid using those on a chronic basis. Some patients will have these kind of standing prescriptions for steroids, and they'll take it if they start having a cough or chronic lung disease. This can increase the rate of colonization with staph. Keep your skin well lubricated and moist, and try to prevent any drying of the skin, because that can lead to micro traumas, and it could increase your risk of getting Staph aureus colonization and infection. So skin, what I usually do is after a shower, I apply skin cream to my arms and legs. If I notice I'm feeling itchy on my skin and I'm scratching, I will apply skin cream as well to keep that area moist, keep it from drying. Move your body around. I see this sometimes in people who sit for long periods of time. Sitting on your butt can increase inflammation and increase the risk of clogged pores, as well as Staph aureus infections. People who are leaning on their elbows a lot. I also see this in paraplegics and quadriplegics, where they're unable to move frequently without assistance. Get plenty of sleep and exercise, and keep your stress to a minimum. This is something that is hard to always see, but I see quite a bit of patients coming in who are under a great deal of stress when they develop these recurrent skin infections. And then finally, if someone does have recurrent infections, there are things we can do to reduce the rate of colonization. So here's the three-pronged approach. Number one is address the risk factors. I discussed those with you. Number two, address the infection. So if there's an acute infection, get that treated. Sometimes if it's just hair follicles that are infected, you can put Band-Aids over the areas. Sometimes you need an incision and drainage with a short course of antibiotics at that time. And then finally, address the colonization state. I usually wait a few weeks. If I do treat someone with antibiotics to address the colonization state, we'll use a nasal mupirocin, which is an antibiotic ointment that you can apply to your nose twice daily for 7 days, as well as skin creams and shampoo. The shampoo that I use is Hibiclens. And this can be used 2 to 3 times a week during your shower. Lather it up to the areas of your neck, under your arms and groin area to reduce the rate of colonization. This should help in most cases. If it doesn't, certainly reach out to me, your doctor, or an infectious disease doctor. This article is intended to just get a head start on controlling your colonization. It does not replace the direct advice from a one-to-one meeting with a doctor or an infectious disease specialist. Thank you so much for listening to this video. If you have any questions or concerns, certainly reach out. Share this video to your friends and colleagues, and subscribe to the podcast and Your Health Forum webpage. Thank you very much.